Imagine, if you will, a stainless steel table in this really brightly lit, totally sterile room, and the air is cold.
Setting a very intense scene right out of the gate.
Right. But okay, so on this table sits a plain cardboard box, and inside that box is this mysterious cluster of bones. No clothing, no wallet with an ID, no fingerprints to pull. There's no soft tissues to give you any easy
It's
answers.
just a skeleton.
Exactly, just these silent, calcium-rich artifacts that were pulled from the earth. Basically, all you have is a skull, a shattered pelvis, and a single femur.
Which is a pretty standard day for a forensic anthropologist, honestly.
Yeah, I bet. So today we are stepping into the shoes of the forensic examiners standing over that table. Our mission for this deep dive is to decode how experts can look at these seemingly mute objects and, literally read the biological story of the person they once belonged to.
It's fascinating because they're not mute at all, really.
Right. We're looking specifically at how they determine biological sex from skeletal remains, and we're going to discover that the process isn't just some vague guesswork.
Oh, not at all.
It's this incredibly rigorous discipline rooted in biomechanical engineering, evolutionary compromise, and just, like, pure physics.
It truly is like trying to read a manuscript written in this ancient physical language. Because, we're so accustomed to interacting with people in their entirety.
With the context of their clothing and their voices.
Exactly. The soft tissues of their faces. We forget that the underlying framework is carrying a permanent record of who they were. So when you strip all of that societal and soft tissue context away, the skeleton has its own dialect.
I love that phrase, a dialect of bones.
Yeah, it's a structural language written in ridges, geometric angles, and these subtle variations in volume. And if you understand the grammar of that language, those bones on that steel table are essentially screaming their identity.
Okay, let's unpack this, because today's insights are drawn from an incredibly detailed forensic medicine masterclass, focusing precisely on sex differentiation in the human skeleton.
Fantastic resource.
It really is. So we are going to examine the exact same physical markers a forensic anthropologist relies on when they're presented with a skeletal mystery. But before we pull out our magnifying glasses and start, measuring the angles of a jawbone, we have to talk about the baseline. We need a blueprint.
Right, you always need a baseline.
And in the source material, this blueprint is defined by something called the Krogman hierarchy.
Ah, yes. The Krogman hierarchy is basically the absolute bedrock of forensic anthropology.
Yeah.
Wilton Krogman was a titan in the field of physical anthropology.
He kind of wrote the book on this stuff, right?
He essentially did, and he established this statistical hierarchy that answers a really practical question. Basically, depending on which bones we actually manage to recover, how confident can we be in our assessment?
Because in the real world, you almost never get a perfectly intact, museum-quality skeleton.
Very rarely. You get fragments, you get scattered remains. Animals get to them.
Right, so starting at the very top of his hierarchy, Krogman states that if you are lucky enough to have the entire skeleton, every single bone from the skull down to the toes, the accuracy of determining biological sex is essentially 100%.
You have absolute certainty.
Absolute certainty. But like we said, pieces are usually missing, the elements scatter. So how does the math change when we start losing pieces of the puzzle?
Well, the reliability immediately begins to shift, and this is where we have to isolate the most valuable players on the skeletal roster. The absolute gold standard.
The MVP of the skeleton.
Exactly. The single most informative, reliable structure in the entire human body for determining sex is the pelvis. If you have nothing else but a relatively intact pelvis, Krogman's data shows your accuracy is an incredible 95%.
95% from just the hip bones? That is wild to me.
It's a massive amount of data in one area.
But, okay, if you don't have the pelvis, the next most reliable anchor is the skull. Standing completely alone, a skull gives you a 90% accuracy rate.
Which is still incredibly high.
Right. And if we drop further down the hierarchy, let's say scavengers have made off with everything except a single long bone, specifically the femur, which is the thigh bone. If all you have is that one femur, your accuracy drops to 80%.
Though, it's definitely worth noting how those numbers rebound if you can start combining elements.
Oh, like a multiplier effect.
Yeah, the synergy of the skeleton is remarkable. Like, if you find a pelvis and a skull, the accuracy jumps back up to 98%. If you have a pelvis and a femur, again, 98%.
Because the bones are cross-verifying each other.
Precisely. they confirm this story.
Well, I have to pause you right there because the math is honestly bothering me a little bit. If the pelvis is the undisputed gold standard of the human skeleton, why is it only 95% accurate? Why isn't it a clean 100? What's hiding in that remaining 5%?
That 5% ambiguity is actually, it's my favorite part of this science because it reminds us that we are dealing with biology, not a manufacturing assembly line.
Right, we're not machines.
Exactly. We naturally want to categorize human morphology into these binary, distinct boxes, a perfect column A and a perfect column B. But biology is messy. I mean, it exists on a spectrum.
So there's natural overlap.
Yeah, that 5% represents the natural intermingling of sexual features within a single individual's bone structure. You might analyze a pelvis that presents with overwhelmingly female characteristics, but it possesses one or two localized features that look distinctly male.
So it's never just a single smoking gun. A forensic examiner can't just find one specific bump on a bone, point at it, and be like, case closed.
Absolutely not. They have to rely on a cluster of features.
Right.
They look at 10 or 15 different markers on the same bone, weigh the predominantly male traits against the predominantly female traits, cross-reference them, and arrive at a holistic conclusion.
You're reading the entire document, not just one word.
Beautifully put, yes.
And before we get into the specific chapters of that document, the masterclass establishes one overarching fundamental rule of thumb, the baseline from which all these differences basically cascade.
The primary rule.
Right. Generally speaking, male bones present as larger, heavier, and physically more massive than female bones. And this isn't simply a matter of men generally being taller, is it?
No, it's fundamentally about bone density and the profound influence of musculature. This is where we really have to introduce a concept called Wolff's Law.
Wolff's Law, W-O-L-F-F.
Yes, it's a foundational principle in anatomy, which basically states that bone in a healthy person will adapt to the loads under which it is placed. We tend to think of the skeleton as this inert, dead scaffolding.
Like steel girders inside a skyscraper?
Right, exactly. But bone is living, dynamic, actively remodeling tissue. It's constantly tearing itself down and rebuilding itself based on how you use your body.
So if a bone is being stressed, it builds itself up to handle that stress.
Precisely. And physiologically, males generally possess a higher baseline of muscle mass. Now, muscles don't just float in the body.
Obviously not, yeah.
They are anchored directly into the bone via tendons. When a large, powerful muscle flexes, it physically pulls on the bone it's attached to. Over a lifetime, to prevent the bone from snapping under that immense muscular tension, the body lays down more calcium.
So the bone grows thicker.
It grows thicker, it becomes denser, and critically for forensics, these specific anchor points where the muscles attach become really rugged, raised, and highly pronounced.
Oh, wow.
Therefore, male bones are literally heavier in the hand, their walls are thicker, and their surfaces look like this rough, textured landscape compared to the generally smoother female skeleton.
I was actually trying to find a good analogy for this while reviewing the notes because visualizing muscle pull can be kind of abstract. It's like the rigging on a sailboat.
Okay, I like where this is going.
The skeleton is the wooden mast, and the muscles are the ropes holding it steady in a storm. If you have incredibly thick, heavy ropes under massive tension, you can't just tie them to a tiny wooden peg. The peg will snap.
It would tear right out.
Right. You need to carve thick, heavy, rugged wooden cleats into the mast to hold those ropes. The male skeleton has thicker ropes, so it requires more rugged, bony cleats.
That is a perfect way to visualize Wolff's Law.
So keep that sailboat analogy in mind because it is the key to unlocking the first major piece of evidence on our steel table, the skull. We are moving to the absolute peak of the skeleton, and according to the source material, decoding the skull relies heavily on morphological features.
Right. Morphology simply refers to the study of form and structure. In forensic anthropology, this means we are looking at the visual architecture.
So we aren't necessarily using a ruler or a pair of calipers to take rigid measurements just yet.
Not yet. We are analyzing shapes. Is a feature sharp or blunt? Is it deep or shallow? It involves a degree of trained subjectivity, which is why experience in a medical examiner is so vital. But the anatomical patterns we are looking for are remarkably consistent.
Let's start with the overall architecture.
Right.
The actual vault that holds the brain. The intracranial capacity, the physical volume of the space inside the skull, averages around 1,500 cubic centimeters in males.
Correct.
And in females, it's roughly 10% smaller, sitting around 3,350 cubic centimeters. But it's not just the volume, it's the shape of the vault itself, right?
Yeah, the masterclass uses very specific terminology here. The male vault is typically classified as a dolichocranium. Translated from Greek, dolicho means long.
Dolichocranium.
So a dolichocranium is a relatively elongated skull from front to back. And tying back to our sailboat analogy, Wolff's Law, the actual walls of the cranial bone are physically thicker to support heavier neck and jaw muscles.
Okay, and the female counterpart.
The female skull is termed a brachycranium, brachy meaning short.
Right.
It is a relatively shorter, more rounded globular structure, and the bone walls themselves are noticeably thinner and lighter. So right away, before you even look at the face, the overall box gives you a massive clue. Is it a long, thick, heavy vault or a round, thin, light vault?
So let's turn that vault around and look at the face, starting from the top down. The forehead. This is something that is so distinct you can almost see it in silhouette.
Oh, absolutely.
In a male skull, the contour of the forehead is steeper. It recedes and slopes backward as it moves up toward the crown. But in a female skull, the forehead is much more vertical. The forensic literature actually uses the term infantile to describe it.
Which simply means it retains that fuller, vertical, rounded shape that we typically associate with the facial structure of a child or an adolescent before the heavy hormonal and muscular changes of puberty take hold.
Interesting.
And what's fascinating here is how these features compound upon one another. Because right below that receding male forehead, you run directly into the supraorbital ridges.
Which are the brow ridges.
Yes. In a male skull, these ridges of bone sitting horizontally right above the eye sockets are significantly pronounced. They jut forward aggressively.
Like a built-in visor.
Essentially, yes. In evolutionary terms, this thick bar of bone acted as a shock absorber for the immense forces generated by early hominid chewing, and it protected the delicate eyes from blows. While it is reduced over millennia, that heavy, bony prominence remains a really distinct male trait. In a female skull, this area, the superciliary arch, is much smoother. It completely lacks that heavy, forward-projecting ridge.
And if you look right between those eyebrows, there is a specific point called the glabella. It tells the exact same story.
It does.
In males, the glabella protrudes forward. It forms this distinct bony bump right between the eyes. In females, it is essentially flat, blending seamlessly into that smooth, vertical forehead.
And this leads us to one of the most beautiful structural transitions in the face, which is the nation.
The frontonasal junction. So for you listening, if you take your finger and trace it straight down the center of your forehead, right between your eyes, to where the bridge of your glasses would sit, that specific point is your nation.
Right. Because the male skull features that heavy, protruding brow ridge and the projecting glabella, when you trace your finger down to the nose, you encounter a sudden, sharp, inward angle at the nasion.
A sharp drop-off.
The bone abruptly cuts inward. It's physically like stepping off a small, bony cliff to get to the nose. But because the female forehead and brow lack that heavy jutting bone, the transition downward to the nose is a smooth, continuous, sweeping curve.
There's no cliff.
There is no cliff.
I love how these subtle angles completely change the profile of a face. But let's move down to the mid-face. This is where I started getting a little confused during my read-through because it seems like everything is connected.
Yeah.
How do the orbits, the actual physical eye sockets, fit into this puzzle?
The geometry of the orbits is incredibly distinct between the sexes, and it actually dictates the layout of the rest of the face. Let's examine the male orbits first. Morphologically, they present as generally square in shape.
Yeah.
But more importantly, they are relatively small when compared to the massive overall canvas of the male face, and they sit lower down on the facial structure. Furthermore, if a forensic examiner slides their thumb along the outer lateral margin of the eye socket, the bone nearest your temple, it feels distinctly thick, rounded, and blunt.
A square, low-sitting socket with a blunt outer edge.
Okay, got it. What about the female orbit?
It is practically the inverse. The female orbit is distinctly rounder, losing those squared-off corners. It is relatively larger in proportion to the overall smaller female face, which gives a more open-eyed appearance in the underlying bone.
Oh,
It sits higher up on the facial structure. And if you run your thumb along that same outer lateral margin, the bone there is remarkably sharper and thinner. You can clearly feel a fine, almost blade-like edge to the orbital rim.
Wait, if the male eye sockets are sitting lower on the face because of that heavy brow pushing them down, does that completely warp the rest of the facial structure below it? Yes. That is exactly the kind of cascading structural shift forensic anthropologists look for. The position of the eyes directly dictates the architecture of the nose. Because the male orbits are positioned lower, they physically crowd the space available for the nasal aperture.
They're pushing down on it.
Right, it forces the nasal opening to be positioned slightly higher up between the eyes. Consequently, the male nasal aperture is taller, narrower, and the bony margins that define as edges are sharp and distinct.
It's a total domino effect.
Precisely. Now contrast that with the female skull. Because those larger, rounder female orbits are sitting higher up on the face, there is more uncrowded real estate below them. This allows the female nasal aperture to be positioned lower down.
Okay.
It is relatively broader, wider, and the bony margins around the opening are blunter and more rounded, lacking the sharp definition we just saw in males.
It's fascinating how one structural anchor point changes everything around it. And moving just below the nose, the source briefly highlights the bony roof of the mouth. The male palate is described as larger and shaped like a wide, broad U.
Yep, a wide U.
The female palate is smaller and shaped more like a parabola, which is slightly narrower toward the front teeth. It's a really subtle shift. But when you are a forensic expert building a case, every single curve adds a percentage point to your certainty. Which brings us to the sides of the skull, the cheekbones.
The zygomatic bones.
Yes, the zygoma. Now, thinking back to our sailboat rigging analogy, the need for thick bone to anchor thick muscle, the male cheekbone, is significantly broader, thicker, and just structurally more massive.
To support the masseter muscle, which is the primary muscle you use for chewing.
But there's a specific detail about the arch of the cheekbone that the masterclass zeroes in on.
Right, they're looking for lateral arching. The zygomatic arch is the delicate bony bridge that extends from your cheek horizontally back toward your ear. In a male skull, this arch visibly bows outward laterally. It has a pronounced outward sweep or bulge away from the side of the head.
And in a female skull?
The zygomatic bone is overall lighter and thinner, and that arch is much more compressed. It hugs the side of the skull much closer and lacks that aggressive outward bulge.
And if we follow that bony arch all the way back, moving past the ear, we hit one of my favorite tiny details in this entire deep dive, the suprametal crest.
It is a beautifully specific marker.
It really is.
The external auditory meatus is the anatomical term for your ear canal, the actual hole in the side of the skull. In the male skull, if you trace the posterior edge of that cheekbone arch backward, it doesn't just stop at the ear.
It keeps going.
The ridge of bone continues, sweeping up and extending past the ear canal, forming a distinct, palpable, bony ridge above and behind the opening. That is the suprametal crest.
But in the female skull,
It's largely absent. The zygomatic arch simply tapers off and ends in front of the ear canal. It rarely extends over and behind it. It's a millimeter-scale detail, but it speaks volumes about the overall rugged, heavily ossified nature of the male skull.
and right next to that ear canal, we find what the masterclass considers one of the most reliable single discriminators on the entire cranium, the mastoid process.
The mastoid process is essentially the grand finale of Wolff's Law on the skull.
The ultimate cleat for the rigging.
Exactly. If you reach behind your earlobe right now, you will feel a downward-pointing lump of bone. That is your mastoid process. It serves as a massive anchor point for the sternocleidomastoid muscle, the thick, powerful muscle that allows you to turn and nod your head.
So a heavier male skull requires a thicker, stronger neck muscle to constantly stabilize it against gravity.
Exactly. That heavy muscle is constantly pulling, constantly applying traction to the mastoid process. As a result, the male mastoid process grows significantly larger, wider, and its downward-pointing tip becomes blunt and rounded from the sheer volume of muscle tissue encasing it.
While the female skull, being physically lighter, requires less muscular force to stabilize. So the female mastoid process is noticeably smaller, and because there is less heavy muscle pulling at it, the tip remains much sharper and comes to a more distinct pointed end.
That's right.
It is literally a physical record of the muscular work required to carry the person's head around for a lifetime.
If we connect this to the bigger picture, the skull is essentially a topographical map of biomechanical stress. And right next to the mastoid process, tucked just on the inside of it, is a groove called the digastric groove.
Okay, what does that do?
It's where the digastric muscle, which is another crucial neck muscle involved in swallowing and jaw movement, originates. In males, because of that heavier musculature, this groove is excavated deeply into the bone. In females, the groove is remarkably shallow.
It's like a river carving a canyon. The stronger the current, or in this case, the heavier the muscle pull, the deeper the groove carved into the stone. Okay, we've gone from the forehead to the eyes, nose, cheeks, and behind the ear. Let's move to the very back of the skull, the occipital region.
Here we find the external occipital protuberance. This is a central bony prominence located right at the lower back of the skull, serving as the ultimate anchor point for the heavy ligaments and trapezius muscles of the neck and back.
The really heavy lifters.
Yes, in the male skull, this entire region is highly rugged. The protuberance itself juts out distinctly, and the bone surrounding it is scarred with pronounced, raised neutral lines where the muscles were attached.
And if you rub your hand over the back of a female skull,
It is generally smooth. The female occipital bone in this area is much more evenly rounded. The muscular markings are faint or virtually invisible, giving the whole architecture a very smooth, swept-back appearance without that jutting, aggressive, bony anchor.
let's pick this skull up off the steel table and flip it completely upside down to look at the base, the underside. The most dominant feature here is the foramen magnum, which is the massive hole where the brainstem exits the skull to become the spinal cord.
Size and geometry are key here. The male foramen magnum is noticeably larger, which logically tracks with the overall larger cranial vault, but crucially, it is oblong in shape.
Like an oval.
Right, it is stretched slightly front to back. The female foramen magnum is smaller and tends to be much more perfectly rounded.
And flanking that giant hole on either side are two smooth knobs of bone called the occipital condyles. These are the literal rocking chair-like hinges that sit on top of your topmost vertebra, allowing your head to nod yes and no.
The condyles reflect the exact same structural themes. In the male, they are larger overall. But if you look closely at the articulating facet, the actual smooth, polished surface that makes contact with the spine in males, it is relatively long and slender. It looks elongated. In the female skull, the condyles are smaller overall, but the facet itself is shorter and broader in proportion.
So we've mapped the outside. But the source material also notes that forensic experts don't just rely on what they can see on the surface. They use radiology to look inside the bone. You can actually determine sex by looking at the hollow spaces, the sinuses.
Yes, specifically the frontal sinuses located behind the forehead and the maxillary sinuses located behind the cheeks. When you place a skull in an X-ray machine, these hollow, air-filled cavities are visibly more expansive and much more extensively developed in the male skull compared to the female skull, where they remain relatively confined.
So if we step back and look at the skull as a whole, it really is a 90% accurate puzzle. You add up the heavy brow ridge, the low square eye sockets, the blunt mastoid process, the deep muscular grooves, the oblong spinal opening, and the massive sinuses, and a highly reliable picture of a male identity emerges.
It's an incredibly detailed map.
But the skull isn't complete without the jaw. So let's smoothly transition from the cranium down to the mandible, because this single bone is a vital chapter in the story.
The mandible is uniquely fascinating because it is the only freely mobile bone in the skull. It hinges, it grinds, and it undergoes immense, repeated mechanical stress from chewing and speaking every single day.
Right.
Just like the rest of the male skeleton responding to Wolff's Law. The male mandible is thicker, deeper, and more massive overall to support heavy bite forces. The female mandible is relatively smaller, thinner, and lighter.
I love the examination technique the masterclass suggests for evaluating the chin. You don't just look at it straight on from the front. You physically hold the jaw upside down and look at the curvature of the chin from below. When you do that, the male chin is distinctly square. The bone goes straight across the front, turns a hard 90-degree corner, and goes back.
That square profile is created by the presence of prominent mental tubercles.
Mental tubercles.
Yes, these are two distinct bony bumps located on the lower border of the jaw, on either side of the midline. In males, these tubercles are heavily pronounced, effectively squaring off the bottom of the chin. In females, those tubercles are much less prominent, sometimes barely palpable, resulting in a chin that is smoothly and gently rounded from side to side.
A square, blocky chin versus a smooth, rounded chin. But here's where we get into some real forensic geometry. We have to look at the angles of the jawbone.
This is critical analysis. We're looking at the angle of the mandible, which in forensic terms is known as the gonial angle or the anatomical angle. This is the very back corner of your jaw, where the horizontal lower border of the bone meets the vertical back part that rises up toward your ear.
Okay, the back corner of the jawline. Got it.
If you look at a male mandible straight on from the front, that gonial angle is distinctly everted. That means the bone physically flares outward, pulling away from the neck. It creates a very wide, strong jawline silhouette. In a female mandible, that angle is straight. The bone drops down without that severe outward flare.
And if you turn the jaw to look at it from the side profile...
From the side, we are measuring the actual geometric degree of the corner. In a male jaw, the back portion, the ascending ramus, stands more vertically upright. Because it stands straighter, the angle at the corner is less obtuse. It's sharper, typically measuring under 125 degrees.
Under 125.
Yes. The female jaw is more structurally relaxed. The back portion slants backward away from the teeth, making the angle much more obtuse, opening up to measure over 125 degrees.
Under 125 degrees points to male. Over 125 degrees points to female. And this brings us to a really clever forensic mnemonic mentioned in the masterclass to help students remember this. The acronym MAS. MAS.
It is an elegant little teaching tool. MAS helps you remember which specific angles of the jaw yield which pieces of biological data. The M stands for the medico-legal angle, which is used to determine the A, age.
Okay, medico-legal is age.
Right, and the second A stands for the anatomical angle, the corner we just discussed, and that determines the S, sex. Medico-legal for age, anatomical for sex.
So the anatomical angle, the gonial angle at the back corner, tells us the sex based on whether it's sharper or wider than 125 degrees. But what exactly is the medico-legal angle? How does a jawbone tell you how old someone is?
The medico-legal angle is measured at the very top front corner of the jaw, essentially where the front teeth are rooted. And what's brilliant about this measurement is how it vividly demonstrates the life cycle of a human bone.
I found this part so interesting.
It's amazing. When a baby is born, they have no teeth, and the jawbone is just beginning to form. The medico-legal angle is very obtuse, sloping heavily at around 140 degrees. As they grow into a healthy adult and their permanent teeth erupt, the bone remodels and builds a strong vertical alveolar process to hold those teeth in place. The angle sharpens dramatically to a hard 90 degrees.
A perfect right angle.
Yes. But as a person enters old age, especially if they suffer from significant tooth loss, the body stops maintaining that bone. Without the mechanical pressure of chewing on teeth to signal the bone to stay strong, Wolff's Law works in reverse.
Oh, wow.
The bone undergoes resorption, melts away, the jaw shrinks, and that angle collapses back down, sloping heavily again to around 140 degrees, mimicking the infant jaw.
That is incredible. The bone physically remembers where it is in its lifespan. So a forensic examiner can pick up a jawbone, measure the bottom back corner to determine if it belonged to a male or female, and then measure the top front corner to estimate if they were young, in their prime, or elderly. It's a biological multi-tool.
Exactly. And just to finalize the mandibular analysis, we have to evaluate the vertical back plate of the jaw, the ascending ramus. In males, this plate of bone is physically broader from front to back. Furthermore, if you run your finger down the posterior border, the absolute back edge of the bone in males, there is frequently a distinct inward indentation located at the level where the upper and lower molar teeth meet. The female ramus, in addition to being narrower overall, features a straight posterior border that lacks that indentation.
And finally, the condyles, the rounded, knobby hinges at the very top of the jaw that actually plug into the skull base.
Consistent with every other joint surface we've examined, the mandibular condyles are simply larger, broader, and more robust in males compared to the smaller, more delicate condyles in females. When you assemble a mandible with a blocky, square chin, an averted sharp gonial angle under 125 degrees, a broad ramus, and heavy condyles, you have constructed a highly accurate picture of a male jaw to pair with that heavy dodecacranium skull.
Okay, we've thoroughly conquered the head. But here's where it gets really interesting. We are returning to our steel table to look at the next piece of evidence. We are moving down to the pelvis, the absolute holy grail of skeletal sexing. 95% accuracy from a single bone structure.
The gold standard.
And this is where we have to fundamentally shift our thinking. Because with the skull, we were talking about Wolff's Law, muscle mass, pulling on bone to make it rugged. But why is the pelvis so vastly superior to the skull for determining sex? Why does it look so radically different?
Because with the pelvis, we are no longer just looking at the biomechanical byproduct of muscle mass. We are looking at the primary biological imperative of a species, which is survival and reproduction. The overarching shapes and features of the skull are largely dictated by lifestyle, chewing forces, and general body size. But the architecture of the female pelvis is dictated by the evolutionary crucible of parturition, childbirth.
The ultimate biological differentiator.
Precisely. In evolutionary biology, humans face something called the obstetric dilemma.
Obstetric dilemma.
Yes. We are a bipedal species. We walk upright on two legs, which requires a narrow, efficient pelvis to keep our center of gravity balanced. However, we are also a highly encephalized species. We have massive, enormous brains. A human fetal head is remarkably large, and it must pass safely through the enclosed, bony ring of the mother's pelvis.
That seems like a major design flaw.
It is a massive challenge. These two evolutionary needs, walking efficiently and giving birth to big-brained babies, are directly at war with one another. Therefore, evolutionary pressure has radically, heavily modified the female pelvic architecture to compromise. It prioritizes creating a wide, open birth canal, resulting in structural differences that are far more extreme and absolute than anything we see up in the skull.
So let's look at the overarching shapes that this evolutionary tug-of-war creates. The source gives us two incredibly evocative visual descriptors. The male pelvis is described as a deep funnel. The female pelvis is described as a flat bowl.
To understand why those shapes exist, you have to look at the ilium, which are the large, flat, blade-like bones that make up the sides of your hips. You can put your hands on your hips right now and feel the top crest of the iliac blades.
Okay, yeah.
In a male pelvis, prioritizing efficient two-legged running and walking, those iliac blades stand very vertical. They reach higher up toward the ribs, and because they are so upright and straight, the hollow area on the inside surface of the bone, the iliac fossa, is very deep. Hence, the structure looks like a deep, steep-walled funnel.
And the female pelvis?
To widen the upper margins of the birth canal, the female iliac blades cannot stand straight up. They flare outwards laterally. They diverge dramatically to the sides. Because they are leaning so far outward, their top edges sit at a lower overall level relative to the spine, and the inner fossa is much shallower. This wide, flared, open structure creates the distinct flat bowl shape.
It's widening the top of the funnel to make room. And speaking of that internal space, let's look at the actual hole in the middle of the pelvis, the pelvic inlet. This is the bony doorway where a baby first enters the pelvis during birth. In males, this inlet is described as heart-shaped.
Yes, and it takes on that heart shape because of the sacral promontory. This is the very top, frontward-facing edge of the tailbone area at the back of the pelvis. In males, this dense knob of bone projects aggressively forward into the pelvic space, creating an indentation at the back of the inlet, making it look like a classic Valentine heart.
But in the female pelvis, having a large knob of bone projecting into the middle of the birth canal would be a catastrophic obstacle.
Exactly. It would completely block the fetal head. So the female pelvis, the sacral promontory is recessed, is pushed far back, minimizing its projection, which results in a pelvic inlet that is much more circular, beautifully elliptical. It maximizes every millimeter of available space for the head to pass.
And as you move down below that inlet, you enter the true pelvic cavity. In males, sticking with the funnel theme, this internal cavity is narrow, deep, and conical. But in females, it is broad, shallow, and round.
And finally, you reach the exit door, the pelvic outlet at the very bottom. Predictably, following the narrow funnel geometry, the outlet is small and structurally restricted in males. In females, it is significantly larger and wider in every dimension to allow for the final, crucial stages of delivery. At every single level, the inlet, the cavity, and the outlet, the female pelvis, prioritizes expansive width and open space over the narrow efficiencies seen in the male pelvis.
Okay, let's get into the specific bony landmarks because there are some wild, visually obvious differences here. Let's start with the obturator foramen. These are the two large, window-like holes located down at the front bottom of the pelvis beneath the hip sockets. In males, these holes are large, and they generally have a vertical oval shape, or sometimes they are described as having a W-shaped base.
While in the female pelvis, the obturator foramen is overall smaller, and critically, its geometry changes. It becomes triangular in shape, with the sharp apex of the triangle pointing forward toward the midline.
Why does it change shape like that?
This shape change isn't random. It is a direct mechanical result of the pubic bones around the hole being pulled, stretched, and flattened outward to widen the entire front of the pelvic arch.
Which perfectly transitions us to the subpubic angle. This is the angle formed right at the front, bottom center of the pelvis, directly below where the two pubic bones meet. The masterclass notes that this is a feature you can literally see from across the room. You don't even need to be up close to the steel table to spot it.
It is remarkably vividly distinct. If you draw straight lines along the inner lower borders of the left and right pubic bones up to the point where they meet in the center, you form the subpubic angle. In a male pelvis, because the whole structure is a narrow vertical funnel, this angle is very sharp and tight. It forms a distinct inverted V shape, typically measuring a narrow 70 to 75 degrees.
A tight, narrow V. Got it.
But in the female pelvis, because the entire lower structure has been widened, flattened, and flared out to maximize the pelvic outlet, that angle opens up dramatically. It forms a broad, sweeping, inverted U shape, measuring a much wider 90 to 100 degrees, Just glancing at a pelvis and seeing that wide Roman arch U shape versus a sharp Gothic arch V shape gives an examiner a massive immediate clue.
And right below that angle is the subpubic contour, the actual edge of the bone. In males, the bone edge there drops down perfectly straight, like a ruler. But in females, there is a distinct concavity, a scooping out of the bone on either side. It's as if evolution took a spoon and carved out a few more millimeters of bone just to guarantee extra space.
And we see this exact same widening effect at the very bottom anchor points of the pelvis, on the ischial tuberosities. These are the thick, rounded, massive blocks of bone at the very base of the pelvis. They are the bones you are literally sitting on right now.
Okay, I feel them.
In a male pelvis, these bones are inverted. Their lower edges point slightly inward toward the center midline.
But in a female pelvis?
They are everted. They are physically pulled, tilted, and twisted outwards and laterally, moving them physically further apart from each other. Again, this purely mechanical shift increases the physical diameter of the pelvic outlet.
It is an absolute masterclass in biological engineering. But I have a huge pushback here. I need to challenge this because it feels like there's a massive hole in the logic.
Okay, let's hear it.
All of these features we just talked about, the wide bowl, the circular inlet, the U-shaped arch, the everted bones you just said, they all develop specifically for the trauma and necessity of childbirth. So what happens if a woman never has children? Does her pelvis just look like a male's deep funnel because she never went through the physical process of having a baby?
That is an excellent question, and it strikes at the very heart of how we understand biological development. You are actually confusing the genetic blueprint with environmental scarring.
Okay, explain that.
A woman does not need to undergo childbirth to develop a female pelvis, because these widening adaptations are hard-coded into her DNA by millions of years of evolution. The shape of the pelvis is a preparatory blueprint. When a female hits puberty, a surge of estrogen floods her system, and that estrogen signals the bones of the pelvis to begin growing outward, flaring the ilium, widening the subpubic angle, and opening the inlet. The body is building the architecture in advance, regardless of whether it is ever actually used for parturition.
So a nulliparous woman, a woman who has never given birth, still has a completely female wide bowl pelvis because her hormones built it that way.
Exactly. And the most incredible proof of this genetic hard coding brings us to a feature called the greater sciatic notch.
The sciatic notch. The master class highlights this heavily.
Yes. The greater sciatic notch is a large, deep, sweeping indentation located on the side of the ilium bone, towards the back of the pelvis where the sciatic nerve passes through. The source material states unequivocally that this notch is one of the single best, most reliable criteria for sexing a pelvis. And the reason it is so incredibly valuable is that its shape is developmental, not hormonal. The differences in this notch do not wait for the estrogen surge of puberty. They are present in the skeleton during fetal life.
Wait, that is mind-blowing. So a forensic anthropologist can look at the tiny, fragile pelvis of a fetus that hasn't even been born yet and determine its biological sex just from the shape of this one notch.
They can. The genetic blueprint is expressing itself that early, and they use something wonderfully tactile and surprisingly low-tech to evaluate it on adult bones. It's called the thumb test.
The thumb test. Explain this.
It is beautifully simple. In a male pelvis, prioritizing narrow pelvic integrity, the greater sciatic notch is narrow and very deeply carved into the bone. If a forensic examiner takes their thumb and presses it sideways into that notch, it fits tightly. The bone hugs the contours of the thumb. There's absolutely no room to wriggle it around.
It's just locked in.
Completely trapped. But in a female pelvis, because the entire architecture is designed to be broader, the sciatic notch is structurally much wider and significantly shallower. If you place that exact same thumb into the female notch, it doesn't lock. There's plenty of open space beside the thumb. You can easily wriggle the thumb back and forth within the notch.
It's such a visceral diagnostic tool. Narrow and deep in males, trapping the thumb, wide and shallow in females, letting it wriggle. And that proportional width is present from before they take their first breath. But we established earlier that while the blueprint is genetic, life does leave scars. And the pelvis carries those too, right?
Yes, it does. While the overall shape is dictated by the blueprint, the physical act of childbirth leaves undeniable trauma on the skeleton. We call these the scars of life. This is where forensic anthropology becomes deeply poignant. because we aren't just reading biological sex. We are reading the lived history of a mother.
Wow.
The masterclass specifically points to a feature called the preauricular sulcus.
Now, a sulcus is a groove, right?
Correct. The preauricular sulcus is a groove located just lateral to the sacroiliac joint, which is the massive critical joint right at the back of the pelvis where the base of the spine connects to the hip bones. The anterior sacroiliac ligament anchors itself right here. Now, in a male pelvis, this groove is infrequent. It's often not even there. If it is present, it's very narrow and shallow.
But in the female pelvis, it is often broad, deep, and deeply excavated. You can spot it immediately. Why is it so different?
Well, we know exactly why it exists. During the immense physical trauma of childbirth, as the fetal head descends through the pelvic cavity, it stretches the pelvic ring to its absolute maximum limit. This puts continuous, extreme, violent traction on that specific sacroiliac ligament. The ligament pulls desperately against its bony anchor point on the ilium. Over time, especially in multiparous women who have given birth to multiple children, that constant agonizing pulling physically excavates a broad, deep trench into the bone.
The bone actually recedes and carves out a canyon under the sheer stress of the pulling ligament.
Exactly. It's Wolff's Law responding to extreme localized trauma. And there is another set of scars right at the front of the pelvis, on the posterior, inward-facing surface of the pubic bones, called parturition pits.
Parturition pits, literal childbirth craters.
These are actual physical depressions, scooped-out pits, or rugged, torn-looking areas on the inside of the pubic bone, right near where the two halves of the pelvis meet at the pubic symphysis. They are virtually non-existent in women who have not given birth.
But in mothers?
In mothers, the extreme stretching of that front joint during delivery literally micro-tears the ligaments attached there, ripping small fragments of bone away and leaving these permanent, rugged pits carved into the surface.
It's the physical, permanent cost of creating life etched forever into the skeleton. That is incredibly heavy to think about, standing over our hypothetical steel table. But let's finish examining the pelvis by looking at the back wall, the sacrum, the tailbone structure.
The sacrum is a massive, wedge-shaped bone composed of fused vertebrae that locks the two halves of the pelvis together at the back. In the male, completely adhering to the pattern of the narrow, deep funnel, the sacrum is longer from top to bottom. It's narrower side to side, and it often incorporates 5 or sometimes even 6 fused vertebrae.
Okay, so it's long and narrow.
Yes. If you turn it and look at it from the side profile, it has a smooth, uniform, gentle, continuous curve from top to bottom. Furthermore, the sacroiliac joint, the actual footprint where it touches the hip bone, is very large, covering the height of 2.5 to 3 full vertebrae.
Long, narrow, with a gentle, sweeping curve. And the female sacrum.
It is entirely built for maximizing space. It is shorter from top to bottom. It is much broader and wider side to side, giving it a much more distinct, flattened, triangular shape.
Yeah.
It usually only contains a maximum of 5 vertebrae. But the curvature is the absolute key difference.
Right, because if it had a gentle, sweeping curve like the male's, it would bow inward and intrude directly into the birth canal, blocking the baby.
Exactly. The female sacrum solves this beautifully. It doesn't have a uniform curve. The top upper half of the bone is almost perfectly flat and straight, keeping it flush and out of the way. Then about halfway down, the lower vertebrae abruptly and sharply bend forward. It's a severe curve right at the very bottom, intentionally keeping the vast majority of the upper birth canal wide open and perfectly clear of obstruction. And that sacroiliac joint on the side is correspondingly smaller, only covering the height of 2.5 vertebrae.
Shorter, broader, flat top, sharp bottom curve. Okay, so we've talked a massive amount about shapes. Deep funnels, flat bowls, U-shapes, V-shapes, thumb tests, and sweeping curves. This is all morphology. It is incredibly reliable. We're hitting at 95% accuracy, but it is still fundamentally subjective. It relies on the examiner judging the look and feel of the bone. But the forensic experts on the witness stand can't just say it looked like a flat bowl. Forensics isn't just an art. It is a hard, demanding science. The courts demand mathematics.
They absolutely do. This is the Daubert standard of evidence. You must be able to prove your findings with testable, objective data. And this brings us to the metrics. How do we take a subjective, visual shape like a wide-flared ilium and turn it into objective, indisputable mathematical data that a jury can understand? We use indices.
Right. We take out the calipers, we measure specific distances, and we do the math. Let's look at the pelvic indices outlined in the source material. First up is the Washburn index, which is also known as the ischiopubic index. I want to understand how this math works, not just hear the number.
The Washburn index is a brilliant mathematical formula designed to explicitly prove the widening of the female pelvis at the front. It compares the length of the pubis bone at the front of the pelvis to the length of the ischium bone at the bottom.
How exactly do you measure that on a complex 3D bone? Where do you even start?
You need a fixed central anchor point, and they use the acetabular notch. The acetabulum is the large cup-shaped socket on the side of the pelvis where the head of the femur fits in. Deep inside that socket is a small notch where the three primary bones of the pelvis originally fused together during childhood.
Okay, so that's your center point.
Right. From that exact central notch, an examiner uses calipers to measure straight across to the furthest, most anterior tip of the pubic bone. That measurement gives you the pubic length. Then, from that exact same central notch, they measure straight down to the furthest point on the bottom of the ischial tuberosity. That gives you the ischial length.
So you have two hard numbers in millimeters.
Right. Then you run the formula. Pubic length divided by ischial length, multiplied by 100. In adult males, because the pelvis is narrow and the pubic bone doesn't need to stretch far, the resulting index number falls between 73 and 94. But in females, the result is significantly higher, ranging from 91 to 115.
Because the female pubic bone is proportionally much, much longer. It literally has to be physically longer to reach all the way across that widened, flared-out pelvic bowl that we talked about earlier. The math is simply proving what the eye is seeing.
Precisely. It is mathematical confirmation of morphological flaring. And we can apply this same mathematical rigor to the sciatic notch. Can we mathematically prove the thumb test? We can, using the sciatic notch index.
How do you measure a notch?
You measure the physical width of the notch straight across the open top from point to point, and you divide that number by the maximum depth of the groove dropping down into the bone, then multiply by 100. Because the female notch is structurally so much wider and shallower, the math reflects it vividly.
What are the numbers?
In adult males, the deep, narrow notch yields an index averaging around 145. In adult females, the wide, shallow notch causes the index to jump to roughly 166.
145 versus 166. Hard, indisputable numbers. And this index works on those fetal bones we discussed too.
It does, though obviously the scale is microscopic in comparison. In fetal males, the index is tightly clustered around 4 to 5. In fetal females, it's 5 to 6. The mathematical distinction, the genetic imperative for width, is measurable from the very beginning.
The source also mentions a couple of sacral indices.
Yes, these are used to mathematically capture the broadness of the female sacrum. The corpora-basal index compares the width of the main body of the first sacral vertebra to the entire width of the top base of the whole sacrum. In narrow males, it's over 42. In broad females, it's under 42.
And the other one.
And the standard sacral index simply divides the total width of the sacrum by its total length. In males, it's less than 114. In females, because the bone is visibly shorter and broader, the index jumps to greater than 114.
Okay, so we've established that the math works. And we absolutely need that math because we are moving away from the complex interconnected cluster of the pelvis. And we are looking at the final piece of evidence on our steel table. A single, isolated, straight bone, the femur, the thigh bone. Krogman's hierarchy says this bone alone gives us an 80% accuracy rate.
And when you are dealing with a single long bone like the femur, you must rely almost entirely on metrics. The masterclass makes a very practical point here. In a lab, or in our hypothetical cold case, if you are handed a single femur, you can't easily judge if it's heavier or lighter because you don't have the victim's opposite sex counterpart in your other hand to compare it to.
You completely lack a control weight, you just have a bone in a vacuum.
Exactly. You might be holding a remarkably robust, heavily muscled female femur from an athlete, or a relatively slight, unmuscled male femur. If you try to guess based on feel or ruggedness alone, you will make a mistake. So you can't rely on morphological feel. You must rely on exact, millimeter-precise caliper measurements.
So where do we measure this massive bone? Let's start at the very top. The head of the femur, that big, smooth, heavy, round ball that plugs into the hip socket we were just talking about.
The vertical diameter of the femoral head is a critical metric. You place your calipers on the absolute top and bottom of that ball and measure it straight up and down. The statistical cutoff point is astonishingly precise across the human population. It is 45.5 millimeters.
45.5 millimeters. That is the biological line in the sand?
Yes. If the vertical diameter is greater than 45.5 millimeters, you're almost certainly looking at a male femur. If it is less than 45.5 millimeters, it strongly indicates female.
And there's a difference in the shape of that ball too, isn't there? The smooth part.
The articulating surface, yes. This is the smooth, polished, cartilage-covered part of the ball that actually rubs against the inside of the hip socket. In a massive male femur, this smooth surface wraps extensively around the bone, forming more than 2/3 of a complete perfect sphere. It's a very full ball.
And the female one?
In the female femur, that articulating surface is smaller and less extensive. It forms less than 2/3 of a sphere.
Okay, so we've measured the top ball. What about the bottom of the bone, the knee joint?
Down at the knee, we measure something called the bicondylar width. The bottom of the femur ends in two large, rounded, knobby structures called condyles that sit directly on top of the shin bone to form the knee hinge. If you take your calipers and measure the absolute widest horizontal distance across both of those condyles, from the outermost edge of the left knob to the outermost edge of the right knob, you get the bicondylar width.
And what do the numbers tell us?
In males, because of the overall massive size and weight-bearing requirements, the width ranges significantly higher, from 74 to 89 millimeters. In females, it is narrower, ranging from 67 to 76 millimeters. Again, you have a very clear numerical separation that a jury can easily understand.
Okay, this is all great math. The diameters and the widths give us the 80%. But I know you, and I know you want to talk about why the femur looks the way it does. And honestly, this next part is my absolute favorite realization from this entire deep dive, because this is where the skeleton stops being a collection of individual disconnected parts on a table and becomes a brilliantly unified, beautifully engineered machine.
If we connect this to the bigger picture, the biomechanics of the femur are entirely dictated by the pelvis sitting directly above it. We have to look at the angles of the bone, because gravity demands an answer to the flat bowl.
Right. Let's visualize the bone. You have the round head of the femur, which sits on a short bony neck, and that neck attaches to the long, straight shaft of the leg bone. The angle formed between that short neck and the long shaft is called the neck shaft angle.
In the male femur, this angle is more upright, standing taller and more obtuse. It measures over 125 degrees. The male femur is designed to stand tall and straight, but in the female femur, the angle is less than 125 degrees. It's flatter, approaching a right angle.
But that's just the top connection.
Right, the most revealing metric, the one that tells the whole story of human bipedalism, is the angle of the shaft with the condyles at the bottom.
Explain this one. How do you measure an angle at the knee?
Imagine taking the femur and standing it perfectly upright on a flat steel table, letting it rest completely flat on its two bottom condyles. Then you step back and look at how the long shaft of the bone rises up from the table. Does it go straight up like a pillar, or does it lean to the side like the Leaning Tower of Pisa? If you measure the angle on the outside of the shaft against the flat table, a male femur will measure roughly 80 degrees. It is relatively straight and upright.
And that makes perfect sense, because the male pelvis is a narrow, deep funnel. The hip sockets are positioned very close together near the body's midline, so the leg bones just drop straight down to the knees like two parallel pillars.
Precisely. But what happens with the female pelvis? We just spent 20 minutes explaining that it is a wide, flat bowl. The ilium flares out, the outlet is wide. Therefore, the hip sockets are positioned much, much further apart laterally.
The starting point of a leg is pushed way out to the side of the body.
Yes. But here is the uncompromising biomechanical reality of walking upright. No matter how wide your hips are at the top, your knees still have to meet in the middle, directly under your body's center of gravity, to allow for efficient walking and running. If your knees were as wide apart as a female pelvis, you would waddle inefficiently like a penguin. The knees must remain close together.
Oh, wow. So if the top of the femur is pushed way out to the side by the wide hips, and the bottom of the femur has to stay locked in the middle under the spine,
the bone must slant inwards. It has no choice. To accommodate the wide pelvis above it while keeping the knees centered below it, the female femur must angle inward much more severely towards the knee. This is often referred to as the Q angle in kinesiology. When you stand a female femur on the table and measure that same angle of the shaft against the condyles, it drops from the upright male 80 degrees down to roughly 76 degrees. It visibly leans inward significantly more.
And it doesn't just lean in a straight line. The bone itself actually bends under that stress, right?
It does. Because of this severe mechanical inward tilt, the shaft of the female femur is subjected to off-center stress forces. To handle holding up a wide pelvis on a narrow knee stance without snapping, the bone remodels according to Wolff's law and develops a slight, visible lateral bowing. The shaft physically curves slightly outward to absorb and distribute the gravitational load.
It is absolutely stunning. A wider pelvis at the top, designed to bring life into the world, literally dictates a steeper angle and a physical bowing curvature in the heavy leg bone below it. You can't change one single piece of the skeleton without the rest of the machine compensating and remodeling to keep you walking. It's a perfectly engineered, intricately interconnected system.
It is the ultimate expression of how our biology is a breathtaking compromise of structural needs. The desperate evolutionary need to give birth to big-brained infants efficiently versus the biomechanical need to walk and run on two legs to survive predators. The female skeleton balances those two immense, conflicting demands through mathematics, flared angles, and bowed bones.
So, what does this all mean? We started this deep dive staring at a mysterious cluster of bones on a steel table. A skull, a shattered pelvis, and a femur. And over the last hour, we've decoded them. We've learned their language.
We have. We've seen how the sheer relentless physical weight of human musculature sculpts the male skull, leaving rugged ridges, blunt mastoid anchors, and a square, heavy jaw designed for force.
We've explored the extraordinary, life-giving functional adaptations of the flat bowl female pelvis, designed with wide notches, sweeping subpubic angles, and the very real, physical scars of bringing life into the world, allowing for a 95% accuracy rate in identification.
And we've looked at the hard, indisputable geometric metrics of the femur, proving that the width of those hips forces the legs into a beautifully complex, mathematically precise inward tilt. By combining the muscular morphology of the skull, the evolutionary function of the pelvis, and the structural geometry of the femur, a forensic expert can achieve that near absolute certainty. They can rebuild a vital, foundational piece of a lost identity.
It's an incredible journey through our own hidden architecture. But before we wrap up and leave the steel table behind, I want to leave you, the listener, with a final thought to chew on. Something not in our masterclass source today, but a natural, slightly provocative extension of everything we've just learned.
The future of our bones.
Exactly. We've just spent an hour proving that our skeletal architecture, down to the exact fractional degree of our femurs, the width of our sciatic notches, and the ruggedness of our skulls, is perfectly, exquisitely shaped by the biomechanical demands of gravity on Earth, the strain of our current musculature, and biological functions like natural childbirth.
Form relentlessly follows function.
Right. So what happens when the function fundamentally changes? What happens if humanity becomes a spacefaring species and spends generations living in low-gravity environments like lunar colonies or Martian settlements? Without the heavy, crushing stress of Earth's gravity demanding thick bones, will Wolff's Law work in reverse? Will the rugged architecture of the male skull soften entirely? Will those mastoid processes shrink away to nothing because the neck muscles simply don't have to work as hard to hold a head up in microgravity?
And consider the trajectory of medical technology. If surgical interventions or the development of artificial wombs fundamentally and permanently change how human life is brought into the world over the next few centuries, effectively removing the evolutionary pressure of natural parturition, will the female pelvis slowly narrow over millennia? Will the wide sciatic notch tighten back up into a deep funnel?
Will the female femur straighten out and lose its bow because the hips are no longer wide? It's a wild thought. Will forensic experts 1,000 years from now look at our 21st century bones and marvel at them like we marvel at Neanderthals, while having to write an entirely new masterclass with an entirely new set of metric and morphological rules for the humans of the future? Our bones may seem silent on that steel table, but they are never truly finished writing their story.
A fascinating evolutionary timeline to consider, and a reminder that our skeleton is a snapshot of our current environment.
It really is. Thank you so much for joining us on this deep dive into the hidden structural language of the human skeleton. Keep looking closer, keep marveling at the incredible machinery inside you, and as always, keep questioning the world around you.